speaker is Dr. Sunny Dzik, who's the co-director of Blood Transfusion Service in the Department of Pathology and Medicine at Massachusetts General Hospital and Harvard Medical School in Boston, Massachusetts. He will be speaking on positive patient identification.
Yeah, so in this section we want to make this a little interactive, but we want to talk about patient identification, because misidentification leads to acute reactions, which Dr. Hume just talked about. So we're talking about getting the right blood to the right patient. That's our goal. So I want to share with you some suggestions about things you might do regarding positive patient identification. I have just two goals. One, to show you, I think, where I believe you're at right now, which is not good. I'm saying this like a friend, but it's not good. And give you suggestions of how you might change and improve patient identification in the hospital. So the first point is that proper patient identification is an absolute key to safety. I hope that Dr. Hume convinced you of that in what you just heard. You know, a handwritten name only is not really adequate. It's not always readable. Spellings are fluid in this sort of the world. So when you get a requisition and a tube and a name written in ink, it may really not be enough. This is what most of the practice is, and what I would like to encourage you is to go beyond that, take a next step beyond that. So this is what your tubes look like. You might say, perhaps you can read that. When I show it around, a lot of people have trouble. They want to turn the tube sideways. They say, well, if I could flip it over sideways, I could see it. All right, I'll put it sideways for you. You still can't see it, it says renal unit on the bottom, doesn't it? Renal unit. And the name of the patient is above that. Maybe you want to transfuse based on that, but I sure do not want to transfuse based on that. That's a good one. Look at this one. The two on the right are siblings. My, huh? So this is where you're at. You're handwriting in ink on tubes and on requisitions. I tell you, if you come, as we do as guests, to your country from another country, this is terrifying. This is not the way you want to transfuse blood products. Right? I say no more. Okay. So I want to show you two examples of things you can do differently. I want to say, just to state that one of these is a commercial system by a company called Typenex, and I have no financial ties to this corporation. I'm not trying to sell you anything. I'm just trying to show you something that exists. So I'd like to show you the Typenex system, and then I'd like to simply explain the homemade system, which you can make. I'll show you how to do that. They both have the same basic concept, which is, and this is the concept I want you to remember, you're connecting vein to vein. Vein of the patient from the time you draw the sample, all the way around through the blood processing in the laboratory, to the delivery of blood to the bedside, to the vein of the patient when you give them the blood. So it's a circle from vein to vein, and you want to connect the dots. Okay, so here's the Typenex system. Here's the first example. And it consists of a wristband with multiple labels, and I've brought them so you can see them. And so I'll ask Dr. Delaney if she wouldn't mind passing them out. I'll just take one. If you could give those out, I'll give one for the table here. Yeah, just pass them around to everybody. Yeah, I'm not taking them home. When I come to Uganda, I come heavy, I go home light. So it's a wristband. You put it around the patient's wrist. You'll be seeing them in a moment, but this is what they look like. You see it on the screen. And on the left-hand side of the screen, I'll put it this way, is an area where you can write. You can write the name on the label. We know you're attached to writing the name. That's good. You don't need a computer. You can just write it with a pen, and then you can tear off that label and put it on the tube. And there's also all these little numbers that you see on the right-hand side of the screen, which are also on this device. So the number stays on the wristband. The name, you write it on, peel that off, and then you also can remove these numbers. Now, how do you use this? So here you are. We've written the name of the patient on the wristband. We've pulled off the little numbers. This is a better picture. So after you've done this, the wristband stays on the patient. His name is there because you wrote his name there. The number, in this case 9429, is part of the device. Each wristband has a different number on it. That number and name is transferred to your tube. And then you have all these little extra numbers, which you can stick on your blood requisition, right on the piece of paper. And so that goes to the laboratory. When the laboratory has set up a unit of blood, the laboratory can peel off one of these little numbers and put it on the bag. Right? The laboratory's got the name and number on the tube, it's got the numbers on the requisition, it's got the number on the bag, and then when you go, that bag is brought to the bedside, you match to make sure that the number on the bag matches the number on the wristband. It's pretty simple. You've gone in a circle, you've created an identity, you don't need any computers, you need nothing more than this alone. I've spoken to the company, they're interested to partner with you, and I told you your name, Heather. Huh? And so they're willing to get you underway if you want to try and start something like this. It would be very interesting to pilot it, to see the utility of this, trying this out. So we can talk more about that after the conference. Okay, you want to get a little simpler, we'll go the homemade way. So in the homemade way, all you really need is a bunch of plain labels, and you can write a bunch of numbers on them with a marker. You don't even need a company-based piece of equipment. So you can picture labels on a page. I'm going to pass these around too, so you have a good, strong feeling for this. And then, in this little bag, what do I have? I have some round pieces of cardboard. My shirts, when I have my shirts done by the lady who cleans my shirts, they come in a cardboard to keep them clean. And you can cut the cardboard into little circles, pardon me, Megan, and punch a hole in it. And you can go to the hardware store and buy, this chain is what we use to turn on lights. This is really cheap, this chain, huh? You know, it's very, very inexpensive. So you can make a little medallion, right, which goes on the patient. Take your multiple labels. One number goes on the patient, one number goes on the tube, the rest of the numbers go on the requisition. One of those gets peeled off, as you can see on the screen. So you put them on your requisition, one number goes on the tube, one number winds up back on the bag, and then when you come to the bedside, you're matching the number on the bag to the number on the medallion. So you don't need the Typenex equipment really to execute this. Meanwhile, by the way, back in the laboratory, since there are multiple examples of that number, if you choose to set up more blood on the patient, you can always peel off another label and stick it on bag number 2, bag number 3, you know, in case the patient needs more than one unit. They're all going to come back and match up with the medallion of the patient. So what you want to go to is name and number. You want two identifiers. I don't think you should drop the name of patients. We know each other by names, so I'm not against names. But as I think you saw in the beginning, handwritten names, it's not good enough. And you need a second form of positive patient identification. It's very simple. You just need something with multiple numbers, one which stays on the patient, a group that goes on the rec and the tube, and then are added to the blood bags, and then you match up the numbers at the bedside. So that's my suggestion that you consider as one way of using vein-to-vein positive identification. And please don't tell me you can't do this. If you can drill for oil, you can cut out cardboard shirts and hook it up to a little chain. I'm certain that you can do this. So this was meant to kind of give you some ideas to think about a new way of doing positive patient identification. And now we maybe would like to open that up for more conversation.